When we discuss the complications of IVF, we will first discuss the causes, the complications that occur because of IVF or during the treatment of IVF. So, the complications can be because of the medications that are given during the IVF procedure. The hormones that are given to produce eggs, they can sometimes lead to the production of excessive number of eggs inside the ovaries. Now when the ovaries have so many eggs, they tend to become very enlarged, and the woman may have discomfort because of the enlarged ovary, and later on, because of this cascade that has started of more number of eggs, enlarged ovaries, she may also develop fluid in her chest and fluid in her tummy, which is called as ascites or hydrothorax. So this may even further get aggravated and may lead to disorders in the blood. The blood may become thickened and all these manifestations may occur. So this is called as ovarian hyperstimulation syndrome. It is generally a short-term complication which starts if the number of eggs has started to grow in an excessive number and may rarely reach the severe aspects which I have just described. So the procedure of IVF has become very well tuned in, and we avoid to have OHSs as much as possible these days. And now there are various mechanisms also that have evolved which have helped in decreasing the incidence of severe OHSs in stimulation during IVF. Women can also develop problems in terms of their mood because of the hormonal changes that may happen. She may have certain breast tenderness that may happen, but again, these are all short-term changes that occur and are generally occurring because of the hormonal changes that are occurring in the during the IVF cycle. Now, during the egg retrieval, that's a second stage for IVF, certain complications may occur. Despite being a very short procedure, it is still a little invasive procedure because we need to insert in a needle inside the body of the woman through the vagina to aspirate those eggs. So this needle can sometimes cause an inadvertent injury to the adjoining organs that are present around the ovaries. May sometimes or rarely, which we don't really see, but yes, these complications are known and reported. It may lead to injury to the bowel and therefore may lead to leakage of bowel, the fetal matter inside the tummy. So they may cause peritonitis. It may cause injury to the adjoining vessels and lead to the development of blood inside the abdominal cavity or hemoperitoneum, and all those complications may occur. Again, though these complications are known to have happened, but they are not very common in expert hands. During the transfer, which is generally a very non-invasive and a very simple procedure, we hardly see any complications. But in rare scenarios, because the embryo transfers have been done and there is some infection that may happen, so the women may develop an infection during the embryo transfer. These are the complications that are seen or can be seen during an IVF cycle. Following an IVF cycle, so the patient is always concerned as to what will happen after an IVF cycle. So obviously there are certain issues or complications associated following that. One of them is multiple births. You see, generally a woman would produce one egg and therefore the chance of having a single pregnancy is very high. However, what happens is that when we do an IVF, we try to optimize the results, and therefore in that we transfer more than one embryo inside because we want at least one embryo to stick inside the uterus, and we still do not know which embryo will be aligned to stick inside. So therefore we may transfer 2 or 3 embryos. So if more than one embryo gets attached, it may lead to multiple pregnancies. So up to twins is an still acceptable, I would say, because obviously having multiples would definitely increase some chances of complications. But if the pregnancies are more than twins, we need to reduce those pregnancies so that the woman is not compromised during the whole treatment cycle, and the risk of having preterm births, IUGR, or fetal or maternal mortality is not increased. So this is a complication that we see after an IVF cycle. The other important complication which is often asked for is the birth defects. So are the kids who are born after an IVF cycle are destined to be having a much higher risk of birth defects? So the answer is not very clear, and still we know that yes, doing an IVF cycle would give him a very slight chance of getting a slightly higher chance of birth defects, but we still do not know if we should attribute it to the IVF treatment or to the group of patients we are actually treating, because all those who undergo an infertility and IVF treatment have certain issues which have delayed their ability to have children, which can be certain genetic disorders or certain other undiagnosed or subtle problems. So though the IVF children can have less than 1% higher risk of having a increased risk of having a birth defects, it is still not very significant. And we try to screen all the children during the antenatal period. All the women are screened very stringently to see if we are not missing out on any other problem. IVF pregnancy can sometimes also result in an ectopic pregnancy. Though we have transferred the embryos inside the uterus, but what happens that the uterus is always in a state of contraction and relaxation. So sometimes when we transfer, the uterine contraction may push the embryo into the tubes, and the baby may get lodged inside the tubes, and therefore an ectopic pregnancy may result. Again, the risk of having an ectopic pregnancy is much less in IVF cycle than the risk of having an ectopic pregnancy in a natural or spontaneous conception. So basically these are the commonly seen risk or complications with during an IVF cycle and after an IVF cycle.